Hello, I'm Miles O'Brien. Welcome back to the Edison Awards Meet the Innovators Forum Earth Day 2021 edition, live from the Babcock Ranch outside of Fort Myers, Florida, where it is a beautiful day. But we don't want too many people outside of Florida to know that. So don't come down. We have too many people coming down as it is. No, just kidding. We'd love to have you here. We'd like to introduce you to our next Achievement Award winner. Reinhold Schmieding is the CEO and founder of Arthrex. It's a leading innovator in the world of medical devices. And he will be interviewed by orthopedic surgeon John Kagan. And they have old friends, I think, right? So this will be like this will be like a buddy film here, pretty much. I'm going to step out because I got to go get ready for the big awards event this evening, which we hope you'll be watching as well. Before they get started on their conversation, though, we'll tell you the tale of a pre-med student who went to a job fair, and the rest is history.
For orthopedic surgeons, this place is a nexus of what's new. Arthrex headquarters, Naples, Florida. On any given day, dozens of them are here on a pilgrimage, learning the finer points of their craft, using the latest Arthrex innovations in surgical devices and implants. There's a lot to try.
We're going to use the shaver just to clean things up a little bit.
This active incubator of innovation creates at least 1,000 new products every year.
Actually, it was 2,000 last year. Our minimum expectation is 1,000 new products a year.
Wow, that's quite a pace.
I sat down with the founder and president, Reinhold Schmieding, for a rare interview.
How do you maintain that?
Well, you have a lot of creative people, and you give them the resources, you give them the autonomy to make decisions.
With 6,000 employees all over the world and nearly $3 billion a year in revenue, Arthrex is a fast-moving pioneer in this arena. It's a privately held company with a focus on the unique mission of helping surgeons treat their patients better.
Economic gain was something I was never really interested in, and that's my one piece of advice for those that are developing a product or starting a company. Follow a passion, do things for the right reason. If you do it for economic gain, you probably won't be successful.
Reinhold Schmieding was born in the Detroit area to German immigrant parents, both physicians. He studied pre-med at Michigan State, but in his senior year, he went to a career fair that changed his life.
I saw this little exhibit of orthopedic implants, and I stared at that table and it was love at first sight.
So he took a job working for a medical devices firm in Munich.
I was in surgery every day helping surgeons, and it was absolutely the most rewarding thing I could imagine doing, and I was very good at it.
At the time, surgeons had just begun using arthroscopic tools to peer inside the body without making an incision.
So this is the original arthroscope.
But surgeons used it strictly as a diagnostic tool.
They asked me, Reinhold, I can see the meniscus, arthroscopically. If I just had some little instruments, I could do this arthroscopically. And at that moment, I just knew I was the right place at the right time.
He told his wife, Erica, that he wanted to quit his job to make the instruments he and those surgeons imagined a reality.
On my little white table in my apartment in the Olympic Village in Munich, on our own, with no outside financing, in a foreign country, in a market that didn't exist, right? Good luck.
Are you one of those people that just saw the vision and pursued it relentlessly?
Absolutely, yeah. I was able to see a problem and design a solution, have the tenacity to go out there and make it. And, I didn't know that until the time. Once I started on that path, it was very natural for me. It was like a calling.
He never stopped answering the call. He steadily built the business, moving headquarters to the U.S. in 1991. 14,000 products and nearly 1,500 patents later, Arthrex continues to rapidly innovate. The surgical instruments have gotten much smaller and are now less invasive. Arthrex also makes internal braces, hastening the healing. Shoulder joints that are smaller and simple enough to implant in an outpatient procedure. And in recent years, they have started developing biologic products.
We pioneered orthobiologics, essentially taking blood or bone marrow from your body, concentrating growth factors or stem cells. So that's been a revolution as well.
So you could make some of your orthopedic devices obsolete if that continues to work so well, right? But
absolutely.
Either way you get it, right?
It's not a business decision. It's really about what's best for the patient, best for society.
The company estimates it improved the lives of 14 million people just last year.
What you've done is given 14 million people, in some sense, greater mobility, which is a great gift.
Our orthopedics really is motion, right? It's, pain-free motion without disability. So everybody wants to live an active life as they age, and we help facilitate that in the least invasive way possible.
Reinhold Schmieding is an inventor who approaches his craft much as Thomas Edison did, by inspiring and leading a tenacious team.
It takes a team to accomplish something like innovation and medical devices at the same pace that we've done for the last 40 years, So it's all about the team, really, and I'm just one of the team players.
He is now 66 with no thoughts of slowing down his relentless pace. The passion still burns inside him.
If I have the ability to create and make a difference in people's lives, help patients around the world, help surgeons, help our employees, and do good, and my body continues to support that and stay healthy, I will continue to do that.
Do you think you could have ever imagined this back in Munich at that drafting table?
Never once. So when you follow a passion like that and you have nothing, you're sacrificing everything, all you want to do is survive, and hopefully you could take care of your family someday. That was my only dream.
With equal parts curiosity, creativity, and persistence, Reinhold Schmieding has turned his dreams into innovations that have changed the world. It's what great inventors do, and it's all in a day's work here at this nexus of what's new. For the Edison Awards, I'm Miles O'Brien in Naples, Florida.
Beautiful. Thank you. Hi, I'm Dr. John Kagan, orthopedic surgeon, and I've known Reinhold since he moved here in 1991. Back in the day, we did most of our surgeries through large incisions, and we were pretty limited in what we would do. MRIs had just come out in 1986, 87. They weren't very good. No one knew how to interpret them. So we were left pretty much with giving people shots of cortisone and then making an incision over their shoulder to look in and see what's there, or specifically what might not be there. And then Reinhold came along. I just have nothing but the most greatest respect for him and what he's done, not only for my practice, but for the field of orthopedics, is I've seen it change. And he has been the major factor in changing it. 1,500 patents, 14,000 products. Most of you sitting out here may have one of his products in your shoulder, in your knee. If not, maybe the equipment that was used was equipment that he developed. And he's just not happy with developing the equipment. He looks at everything. He looks at how to make the cameras better, how to make the instruments better, how to make the implants biocomposite so that they become bone. These are all realities that he has brought to us. It's just amazing. So, Reinhold, I have some questions for you. Right now, I think one of your main focuses is education. You've built this beautiful campus, and for the surgeons, you've built labs for them. You've built all sorts of educational things. You started the Orthopedic. You have done so much for the surgeons. And then for your team, your surgical reps, they are all well-trained. They come in the operating room. They're a big help to us. They help us problem solve if we need the help. And then with the patients, you now have Ortho Illustrated online for patients to learn. Even you said, this goes so far that his company's mission statement is helping surgeons treat their patients better. Tell me about that.
Well, since the early days, I was part of medicine and science, coming from a medical family, and I was offered a job to go overseas, go to Germany in the medical orthopedic device industry, and I'd spend time with surgeons in the operating room, and I just obviously loved it. Loved the technology, I loved the science, I loved the medicine, and being part of the team to help surgeons treat their patients better. And that was really my calling early on. And surgeons taught me. We were invited in surgery. We would be invited to scrub in, and we would learn and help solve problems. And that became really a passion of mine. And I was able to design some of the first tools to do partial meniscectomies. Like you said early on, you made incisions and you resected the meniscus. At some point, if you can see the meniscus with the arthroscope, why not have a small instrument where you resect a part of the meniscus, and instead of having open surgery? And that was really the beginning in 1981.
And now you do a lot more with the meniscus, don't you?
Oh, yeah. Well, obviously today we try to preserve the joint, so we preserve the meniscus, so instead of resecting the meniscus, we've got 5 different meniscal repair devices to repair the meniscus and preserve your joint, preserve your meniscus. We've learned over the years that the meniscus plays a major role in preventing arthritis. As you know, you're today probably preserving the meniscus more often than resecting it in your practice.
I try to. Yes, I do. And that's all crazy stuff. Who would have thought that in the old day you used to take this knife and cut the whole thing out? It was called a Schmeiding knife. Mm-hmm. And so you couldn't see it on any imaging. There were no MRIs and there was no arthroscopy. So you'd make an incision and just whack the whole thing out. And now, with Reinhold's company, we try not to take the meniscus out or try just to take a little out and repair the rest of it. So that's one of the ways that he is helping, us all keep our joint preservation and stay active longer. So talk to me more about education.
So arthroscopy is technically challenging to learn. As you know, you've been through that learning curve many years ago. Right. Where you have a 30-degree angled optical lens, and then you have to navigate through the joint. You have to relearn seeing the anatomy from a different perspective. You have to distend the joint with fluid, and you have to insert instruments, and then you have to navigate, and it's really quite a learning curve, So early on, we had to create a lab to actually teach surgeons these surgical skills. And early on, we used plastic models, to treat basically resection of the meniscus, a repair of the meniscus, and then we started treating the ACL, and education was the foundation of what we did. Developing the products was just the first step. Providing a safe and ethical environment for surgeons to practice their skills, learn those skills. Just like a professional golfer needs a driving range and to practice their skills every day, surgeons need a safe and ethical environment where they can practice these new techniques with new technology and not have to experiment on their patient. And I was dedicated to that process from day one. Today, we educate over 50,000 surgeons around the world in over 100 surgical skill training labs, and we'll have 15,000 surgeons visiting us here in Naples, this year from around the world. So we really become the destination for not just product innovation, but also for education of what's next in orthopedics.
So I think that's really amazing for surgeons because he doesn't just turn the equipment loose and hope to goodness you do it right. He takes you by the hand, leads you through a lab, and makes sure that you understand all the innuendos about the procedure you're trying to do and all the techniques and the pearls of doing it so that your patient does better. And that's what Arthrex, a.k.a. Reinhold, is interested in. He's interested in helping surgeons treat their patients. So rumor has it that you don't sleep a lot and that you think of new ideas in the middle of the night, and sometimes you text your product managers at 3 in the morning about some new idea that you've thought of. And then when you get to work, you want to know what they've thought and what they've done. How do you come up with all these ideas that you do? I mean, who can do this but you? No one else does this but you.
Well, obviously, Thomas Edison obviously did it very well.
He did it.
Yeah. So, when in the early years, I was the engineer, I was the product manager, and I had to envision the solution to the problem, and I had enough tenacity to go out there and actually make it, manufacture the product, test it, and bring it to the surgeon to test, and that's what I did. And today there's a whole team of people, scientists, engineers, product managers, orthopedic surgeons on staff that contribute to that process. But I'm still an addicted inventor, and I have over 150 patents, and I love solving problems. So yeah, it's many times I'll be going to bed thinking about a problem and a solution. I'll wake up in the middle of the night. There it is. And where's my piece of paper or my phone? And I have to write it down so I won't forget it and then go back to sleep.
See, that's what he thinks about when he wakes up. I think about hitting the snooze button a couple times. Well, how about some of your products? Let's talk about Drew Brees and the internal brace, or Brooks Koepka and the internal brace, or Tua and the ankle tightrope. I mean, your products have literally affected sports and dancing, pretty much every facet of things.
Yeah, we developed a product called the internal brace, and you've seen some prominent athletes recently get these procedures. Drew Brees, came back literally in 5 weeks and played professional football with a ligament injury to his thumb, where the surgeon repaired the ligament and then reinforced the repair with high-strength tape with 2 little screws into the bone that really kind of gave it protection during the healing process, and allowed him to accelerate his rehab and come to sports a lot faster. Brooks Koepka, we all know, a professional golfer, dislocated his patella 5 weeks before the Masters. Went to our prominent surgeon in LA, Dr. Neil Alatrash, and he had surgery 3 weeks before the Masters, repaired his ligament, and then reinforced it with the internal brace, was hitting balls 6 days later, and actually came back and played in the Masters. Missed the cut by 2 shots, unfortunately, but that would have been a great comeback story. So there's a lot of stories like that too. Of our the Alabama quarterback, had a high ankle sprain, and they repaired him and came back 5 weeks later and played.
These were injuries that would end someone's season. That would take 9 months to get over. That's how long it takes for soft tissue to heal, a ligament to heal completely. 6 weeks in some type of immobilization, and then a lot of rehab. And suddenly, with the internal brace that you developed, you don't have to go through that. You can start moving pretty quickly. But the one thing that you think is the future here is biologics. And, I've had occasion to use your biocartilage on a baseball player for the Twins that had a lesion, and on his femoral condyle. I've had a chance to use, your PRP, which I use a lot. And you are developing, I understand, some, you have stem cell preparations you're working on. So can you tell us a little bit more about that?
Yeah, so in the early years, we learned from scientists and surgeons in Germany that if you can concentrate growth factors from your own blood and inject it into an injury, such as tendonitis or early stage arthritis, you can really treat these injuries or this condition safely from your own blood, using your own factors concentrated in your own body to help treat and accelerate healing. So we learned that 20 years ago. And in the United States, took a while to get FDA approval. We had to do a lot of animal studies with horses, and pretty obvious, a horse is lame, and then you treat it with PRP, and then the horse is running again. You knew it wasn't a placebo effect, right? This is working.
He doesn't know the difference, right?
And so Dr. Jim Bradley, he was the Pittsburgh Steelers team physician. He had a number of athletes that were injured prior to the '96 Super Bowl, and 2 weeks before the Super Bowl, the FDA approved our PRP system, and the next day he started treating some of his athletes, including Heinz Ward, with a grade 2 MCL, medial collateral ligament tear, and he came back in 2 weeks and played in the Super Bowl, and they announced it during the kickoff that Heinz Ward had come back because of this new treatment, and that was the beginning of biologics here in the United States, and the use of PRP for the treatment of tendonitis, ligamentous, and arthritic conditions.
So when I say he is interested in this, what that means is not only does he come up with a technique to do it, but he comes up with the equipment, the centrifuges, whatever else, delivery systems that you need, and he makes them foolproof. So, there's a lot to be said in our business about sterility and about deployment of these things. So much like he did with arthroscopic surgery, he's taken that, and we talked about the knee. I'll diverge a second about the shoulder, the rotator cuff. It's not really an orthobiologic, but for the rotator cuff tears that are too large to repair primarily, he has an allograft patch made of
Human dermis, yeah.
human dermis called an Arthroflex graft, and we use this to augment our repairs. So when we have someone with poor quality tissue, we can sew this tissue and it will incorporate into the rotator cuff and make the tissue thicker and survive better. And then there are other techniques, and he goes, not only does he develop these techniques, but then he teaches you how to do it in his labs. So that, you're an arthroscopic surgeon, and you might have learned to do a few things in your fellowship or residency, but when you get out and you start, working with Arthrex, before long, you're doing all sorts of things that weren't there 5 or 10 years before. And that's kind of how he does it.
Well, if I can add, we're working with surgeons around the world every single day, the most prominent thought leaders around the world. So we've got great mentors, and Dr. Kagan has been one of those mentors since I came to Southwest Florida in 1991. The first surgery in Southwest Florida that I attended, I wanted to see the best, and I went to see Dr. John Kagan here in Fort Myers, and he was doing an arthroscopic ACL procedure. This is 30 years ago. And, it's that relationship between surgeons and the engineers and the scientists that we have, and that partnership is really how we progress together, So thank you for what you do to take care of patients.
Well,
thank you for educating us, and you're a guiding light for all of us.
And I think most surgeons that are like me would thank you because of all these advancements that you've made that make us do a better job taking care of our patients. I would like to sort of end this discussion with his latest and greatest new thing. And it's a Nano Technology, and I've seen it shown. So I'd like him to talk to us about his nano scope and his nano instruments and what that could mean for you.
So we pioneered the transition from open surgery to arthroscopic. We have a 6 millimeter diameter camera that goes into the joint, and you have small instruments that help treat the injury. Now we've reduced the diameter of those imaging products from 6 millimeters down to less than 2. So it's almost like a needle stick. And the advantage there, it's obviously there's less post-op pain, less infection risk. You don't need general anesthesia. You can do this under local, like in a treatment room or even your practice, to look inside the joint as an alternative to an MRI. And then in the future, we're going to start treating all those pathologies that we treated in the past with a standard arthroscope with a needle stick. So it's going to be a revolution again, of being less invasive than we did in the past.
And who's going to be at the forefront? Arthrex, and you're going to have to develop the small instruments, which you already are, right?
Yes.
And so you'll take it yet another step down to where we're using I'm not even sure we make incisions anymore. We just like a needle stick, right?
We call it incisionless surgery because there's no scalpel and there's no stitches. It's just a little Band-Aid at the end of the case.
Knee, shoulder, ankle.
All joints.
Elbow. Yep. Okay, wrist. So there you have it, folks. This is an amazing inventor, a wonderful human being. He does it for all the right reasons. I am completely honored to be up here on the stage with him. Reinhold Schmieding.
Yeah, thank you, Dr. Kagan.
I would like to thank Dr. Kagan and Reinhold. That was absolutely spectacular. Thank you so much for your time. Just to wrap up here, I remember when I grew up in New Jersey, and I remember the first time I went to Menlo Park and in Edison, New Jersey, to visit the labs. And the one thing that struck me was how many times he had failed to be successful. And from that day forward, I realized failing is okay because that's how you learn. And it really influenced my life going forward. But I think Thomas Edison would be incredibly proud of what the Edison Awards have done, and particularly of all the innovators that are here today. So thank you all very much. The buses are over here. They're going to take you back. I look forward to seeing everybody tonight and learning more about all the great innovations and innovators. So thanks again, everybody. Thank you for being at Babcock Ranch.